Welcome, everybody. If you are on your way to taking the NCLEX exam, maybe you have a test date coming up soon, or you are a nursing student preparing to graduate, you're in the right place. I'm Professor Regina. Hi, and I am here to help you pass your NCLEX. The way that I do it is inside of my virtual trainer program. I call it the V2. It has everything that you need in order to pass NCLEX with content plus questions. So I'm just saying, you all know how important it is to be prepared for an exam like the NCLEX. There are a lot of topics that needs to be reviewed, and I don't want you to go into the exam unaware or afraid or not confident. Okay, so you're here today. And if you're here today, we're going to cover the subject of Cushing's disease. Cushing's disease. And Cushing's disease is so important. I go over it not only in Quick Facts for NCLEX, for those of you who have that book, right? It is definitely, and let me know the page. Hi, Doris. Hi, Jamaica. I have Jamaica in the house today. I'm so excited about that. This topic is in Quick Facts for NCLEX for sure, but it is also in the V2 student workbook on page 82. Yeah, on page 82. So this is a subject that I go over in both books because it is that important. And I'm feeling like I might even play the video inside of V2 just so you have an understanding about what are the most important concepts to know for NCLEX. So today, Cushing's syndrome. Don't forget, everybody, if you want to join me to answer the live study questions in the back of this lecture presentation, do me a favor, send a quick email to support@remarreview.com. That's my email address. It's support@remarreview.com. Put in the subject live study group, and then Mark will make sure that you get on, or Team Remar, they'll make sure that they see you, and we'll take a couple people to join me live on today. So send the email, and hopefully you will get to come on. I'll get to see your face and say hi to you. Also, we are in the middle of Remar Nurse University. Actually, this is another class that will be happening during prime time, which is tonight at 8 p.m. Eastern. It's all about pharmacology. That's what we've been focusing on, but we've been doing it in the midst of case studies. So our patient for today is Lynn Vitros, I think. So if you have the workbook, we will be filling out that. Again, class is 8 p.m. Eastern time. I want to make you aware of all of these free community events that we have so that you understand if you want to pass NCLEX, you literally have everything that you need to do that. You have everything that you need to do that. Going to remarnurse.com/RNU, if you want the workbook, you're able to even watch the lives from previous weeks. Hey, Elderic Kenya is in the house again. Hi, AT, I see you. Hi, Alberto. So we're going to be talking about Cushing's disease. Before we get into it, just kind of prepare your minds for what that patient with Cushing's disease will look like. What is the issue with Cushing's disease? What is the treatments? What are the symptoms? What are the emergencies? That is how you break down a subject for NCLEX, by just asking yourself those general questions. Again, if you have Quick Facts, those questions are in there for you, but let's review it together right now. Oh, also, I got to just remind everybody, because I'm getting these messages on TikTok, because people think that this is like the review, and I'm sorry, it's not, guys. People saw a testimonial of one of our nurses, and she was talking about how she read this book. She read V2, she did V2, and they think it's just a book. But remember, when you order this book, let me make it big. When you order the V2 workbook, it will come mostly blank. Okay, so you can kind of see with the light, there is no full content with this book apart from you watching the videos. So you do have to watch the lecture videos in order to have all of the information from this workbook. Now, this workbook is very, very important, but you need to watch the videos for this. And the videos that I'm talking about are what videos? These videos, not the YouTube videos or the Facebook videos. Very, very important, okay, to watch those videos inside of my full program. Now, Quick Facts is the book, just for orientation, that is question and answer. So this book is a complete book that you study that is all finished, but you will be working to complete this workbook. So actually, I'll play the video for page number 82 tonight after this, well, after this lecture. Not tonight. I'll play it now. All right, but let's go in and let's do Cushing syndrome for all of those who are here attending class today. When we talk about Cushing syndrome, what is the issue? It is it is an adrenal disorder. Yes, I have good questions here. If you're taking PN class, can I buy the V2? Absolutely. We have an RN and we have a PN version. I'd love for practical nurses to do their due diligence and do an NCLEX review. I think it is so important because your NCLEX PN programs are typically very fast and they are skills focused. So it's easy for you to miss these important points. For sort of like what we're going over today. So Cushing's disease, when we think about it, you will study Cushing's syndrome, part of your endocrinology review, right? We are talking about a disorder of the adrenal glands. Now, what is the purpose of the adrenal glands? What do they do? Where are they located, right? So the adrenal glands, the focus of the adrenal glands is to help us to what? Handle stress, is to help us get through those tough periods in our lives where we are overworked, where we are underpaid, where we are students sitting in class, where we have an illness like influenza or COVID or chickenpox. That is when we get the adrenal hormones, we get the cortisol, we get the adrenaline. The adrenal glands are very important. They are located on top of the kidneys. Very good. They are located on top of the kidneys, and they are transmitted to, they are talked to, they are communicated by the pituitary gland, right? And so when we have an issue called Cushing's disease, we have a disorder of hyperfunction. So we know hyper means too much, and the adrenal glands are putting out too much of the adrenocortical hormone, or cortisol specifically. Cortisol is a natural hormone produced by the adrenal glands, and it helps the body respond to stress and change. So when you have too much of it, there are some issues that occur, and cortisol actually can change the way, not only the way you feel, but the way that you look. Not only the way you feel, but the way that you look. Yeah. So what's the statistics of this? Cushing syndrome, much more common in females than males. The median age of acquiring this specific disease is middle age, so your 30 to 40 range. And a lot of patients actually are suffering from this. About 10 to 15 million people are affected every year. So is this an NCLEX subject? Very much so. So what causes it? Like I said, there are several factors that can cause it, but essentially the pituitary gland is having a hypersecretion of the corticotrophin hormone. All right. And so when that happens, corticotrophin, it is something that is secreted to let the anterior pituitary know that, right, that let the adrenal glands know that it is time to pump out some more cortisol. And so this can happen typically if a patient has a tumor in the anterior pituitary gland that is causing some excess pressures or stressors or miscommunications, then the patient can end up with Cushing syndrome. Or also, the most common reason that a patient gets Cushing's disease or Cushing syndrome is because of medical care. So that means they are taking a synthetic form of cortisol, a glucocorticoid most likely, and they are developing Cushing syndrome. So we as healthcare professionals can cause complications in our patients. So again, this is another reason why it's very important to know for the NCLEX exam. Another thing is maybe you don't have a tumor in your anterior pituitary gland. Maybe you have one on your adrenal gland. So adrenal tumors can also cause increased production of cortisol, which is Cushing's disease. Now, the thing about adrenal tumors, they are usually benign. They're usually benign in patients. So, facts and things for you to know. I have some testimonials here. I don't want to pass them by because they are so important for us to recognize when a Remar nurse, like Nurse Brittany, comes in and says, I did, I passed my NCLEX. Thank you, Professor, for your awesome program. Thank you so much. I love that. I could do it. Good day, Professor Regina. Just wanted to inform you that I sat and passed the NCLEX LPN on June 17th using V2. I am so happy. She says, thank you so much. You're the absolute best. Congratulations to you. You have your license. I'll miss you. I'll miss you coming to the class. I'll miss you seeing your initials, but don't forget about us, okay? We are still on the grind here, and we need you. We need you to come back and just cheer us on. Just give us a whoop, whoop. Who's next? I ask that all the time. Who is next? Because, baby, we passing the NCLEX this year. We getting our license. All right. A little Nurse Henrietta came out there. Did y'all catch that, baby? Yeah, y'all might see Nurse Henrietta around Christmas time. All right. Pathophysiology. Let's talk about why this happens, this Cushing disease. So you're having a loss of normal inhibition. Cortisol is based on a feedback program, meaning that when the anterior pituitary gland, oh gosh, hypothalamus, help me, it's Monday. The hypothalamus communicates to the pituitary gland. They're talking to each other all the time, right? And the idea is that the hypothalamus is telling the anterior pituitary gland, we need a little bit more cortisol. So then the anterior pituitary gland tells the adrenal glands, pump out the cortisol, because the cortisol is made where? The adrenal glands only. But the adrenal glands won't make it unless they get the signal. So it is a feedback situation. So anyways, when cortisol is circulating in the bloodstream, a message is supposed to get back to the anterior pituitary gland to tell the adrenal gland to stop. It is a negative feedback system. So when there's cortisol in the bloodstream, the anterior pituitary gland says, cut it off. However, that's not happening in Cushing's syndrome, Cushing's disease. The patient is still having an elevated cortisol level in the bloodstream. It's very important that you understand it's circulating cortisol. And the anterior pituitary is not doing anything. It's not doing anything. So elevated levels of cortisol, this is the second point I'm reading here. Elevated levels of cortisol do not suppress the hypothalamic and anterior pituitary secretion of the CRH, or corticotropin releasing hormone, in corticotropin. All right, that doesn't happen. And so this results in excessive levels of circulating cortisol. Okay, do we understand that? Can I move forward? All right, well, it was important for me to explain that in detail. So the clinical signs and symptoms present as patients struggling to lose weight. They actually are obese, they're gaining weight. And think about this, a lot of females who get Cushing's disease are what age? They are middle age. And if you are middle age, how difficult is it for you to lose weight? You're struggling with weight sometimes. And you may be thinking, why is this happening? So a lot of women who have Cushing's syndrome, it goes unaware for a long time because they're just tired, right? They have the fatigue, they have the weight gain, and they just feel like, well, maybe I'm middle age, right? But no, it's not that. You have Cushing's. Muscle weakness is also a thing. Now, you can also see some buffalo humps, right? Buffalo humps. Thinning arms, muscle wasting. So you have thin arms, thin legs, but you have truncal obesity, thin, fragile skin. Okay. Moon face, ruddy complexion. Okay. Hirsutism, what does that mean? Truncal obesity. Like I said, the arms and legs are very thin, but the trunk of the patient, that middle part of the patient, is obese. Broad purple striae, bruising, and impaired wound healing. So these are the physical signs and symptoms that the patient may report, the subjective signs and symptoms. It is also important for you to know the laboratory changes of a patient with Cushing's disease. So how do we diagnose Cushing's disease? The first thing that is done is called a low dose dexamethasone suppression test. What is that? You know what it is. You know what this is. And you're probably like, no, I don't know what it is. You do, because the name tells you everything you need to know. What medication are we going to be giving the patient? What type of medication is it? We're giving the patient dexamethasone, right? And are we giving a high dose of it, or are we giving a low dose? We're giving a low dose, and a low dose is about 1 milligram. Yeah, so we're giving about 1 milligram of a steroid to the patient. Now, what are we anticipating will be suppressed? What is going to be suppressed in this patient? Somebody tell me, somebody write down in the comment. You're talking your way through this because you know it. You know it. All right. We are expecting a low level of cortisol. That's it. We're going to give 1 milligram to the patient, and ideally that should bring down the cortisol levels of our patient in the bloodstream. That's it. Okay. Now, in normal people, that's what's going to be happening. But in somebody with Cushing's disease, is this low dose dexamethasone suppression test going to do anything? Is it going to work? No, it won't, because the patient has that inhibition system turned off. So even though there are steroids in the blood, the body is still going to be producing its own cortisol as well. So that's a diagnostic test. The second thing is imaging studies. You can do an ultrasound, you can do a CT and angiography if you're looking for adrenal tumors. CT scan or MRI of the head also helps if you're doing a pituitary tumor investigation. Electrolyte levels, because we know that in Cushing's disease, we have patients who have serum sodium levels, and they also have a decrease in potassium levels. So boom, that's that. And blood studies increase in blood glucose levels as well. Okay. Now, the client may require radiation in terms of treatment. So what are we going to be monitoring? What are we going to be thinking about for this patient? Well, we're going to be trying to restore some balance. So that could mean suppressing the cortisol production, okay, by irradiating the adrenal glands. We can do that. Or we can replace that cortisol that the patient is losing. So radiation, okay. We can do drug therapy, and that's giving adrenal enzyme inhibitors, okay. Now, if you're doing any of that, you're going to have to give the patient cortisol replacement therapy, all right. And so that's essential. So it says cortisol therapy is essential preoperative to tolerate the physiologic stress imposed by the removal of the pituitary or the adrenals. And that's the same thing with this transsphenoidal hypophysectomy. And it's essentially going up through the nose and removing a tumor in the pituitary gland. This transsphenoidal approach is better than cutting the cranium. And that makes sense if you think about it. And the adrenalectomy as well, removing the adrenal glands. Okay, so what are our nursing responsibilities to these patients? What are we going to do before we answer these questions? What are the responsibilities? The responsibilities are going to be monitoring the vital signs, especially the blood pressures. Now, Also, you want to check the laboratory tests because hypernatremia, hypokalemia, hyperglycemia, and glycosuria are going to be issues that the patient may have. Okay, they're going to be things that the patient may deal with. And because this patient is essentially retaining fluid, they have an imbalance in their cortisol level. Number 3 says check for edema and carefully monitor the daily weight, intake, and output of your patient. Okay. And why are we watching for infections? What do we remember about how steroids interact with our immune system? And I think somebody said it here earlier, but I missed the comment to spotlight it. What do steroids do to the immune system? Come on, Remar nurses. It's Monday, but I see the comments going. Yes, when we talk about steroids, giving patients steroids, we have an issue where steroids are going to suppress the immune system. It suppress the immune system. Very good, very good. So we're watching and we're monitoring these patients for infection. Number 5 says doing passive range of motion for clients who also suffer from osteoporosis and are bedridden. So we want to make sure that that is something that the patient is able to do. All right. And evaluating the patient. Let me read this note about Cushing's disease and the therapy that's used to treat it. After successful therapy, the client will take medication as prescribed. These are the goals. They'll take their medication as prescribed. They will recognize signs and symptoms of an underdose or an overdose, and they will carry medical identification. Now, fluid, electrolyte, and plasma cortisol levels will be within normal limits, and the patient will seek counseling for stress as needed. So being able to minimize your stress, whether you have Cushing's disease or what is the opposite of Cushing's, because both diseases, you need to be able to handle stress, okay? Because your cortisol level is off. So what is the opposite of Cushing's disease? You have either too much cortisol, which is Cushing's, or you have Addis. You have Addison's disease, which is the opposite. Very good, very good, very good. So both of these, you need to be able to handle stress. Excellent, excellent, excellent. Okay, so again, tonight, we're going to pick up at what time? 8 p.m. Eastern Standard Time to finish off Remar Nurse University. And we will be talking about psych tonight. So make sure that you show up here. I want you to attend every class because the information that I'm giving, of course, is very beneficial to you. For those who wanted to know, I think we have just 10 or 11 days for the 50% off sale of the V2 for you to be able to get into the full program. And that is what this entire thing is going to help you, assist you, prepare you for the NCLEX. And so 50% off is huge. We will not do another sale on the V2 like this probably until, I don't know, Black Friday sometime, maybe, and that's in November. So even if you purchase it for the sale price and then delay your start date, it is better for you to take advantage of this opportunity here for this sale. All right. And again, somebody says, "Oh Lord, wake me up at 8 tonight." Yes, yes. And again, the V2 for those of you who don't know, is the full program. It has the videos, the question bank, and I wanted to show you this because I don't think I did. The physical workbook is the physical book is the quick facts, and the digital workbook is the one that you're going to get inside of the program. Okay. Because usually I'm holding this one up and people are looking for this one to come, but you add this one on if you want it. If you just purchase V2 without adding this, you're going to get the workbook in the file vault. Let me take you here. So you're going to go to the file vault and you'll be able to print out this student workbook. And this is the one that you're going to get. Okay. You're going to get this one that you will print out on your own. So many students jump into V2 and they're looking for the workbook. It's there. Okay. Another thing that I just want to show you is the daily study calendar, because this makes a difference on whether or not you are going to complete the program in the time that you want to, or if you're going to just do it on your own. But you don't have to do it on your own. The daily study calendar is here. Okay. It's also in the file vault. Let me try to blow it up. Boom. Okay. So the daily study calendar will go over, all right, we'll go over what you are doing for every study session. And there's only 20 small ones. So 20 small ones. So every time you sit down, you should be looking at your daily study calendar, because if you're on session 5 or if you're on session 6, there is something for you to do. There's something that I want you to do. And it's really easy to be able to incorporate everything when you follow the study calendar, because I tell you when to watch the lectures with this book, when to study quick facts, this book, and then also when to go into the question bank. So everything can be done in 30 days if you are using that calendar. Some people get it done in quicker time than 30 days, but it's better for you to have a plan. If you don't have it, somebody says, I'm doing it on my own. If you don't have it, go to remarnurse.com. You can sign up for V2. Okay. And I'll go back out into V2 because I'm going to play a video from in here. Okay. Now, let's go into the NCLEX questions. Okay. NCLEX questions. So I want to see comments on the screen. And then I'll answer all these questions I see popping up on the side panel after that. Okay. Well, first NCLEX question here. Again, we talked about the content. Now I want to see if you have understood what we just reviewed. And so the reason that we do questions is to evaluate ourselves. Okay. Question number 1 is this. A nurse is caring for a patient with Cushing syndrome. Which of the following is the most important nursing intervention? Number 1, monitor blood glucose levels closely. 2, encourage the patient to increase sodium intake. 3, instruct the patient to avoid weight-bearing activities. Scammers, y'all. Be careful for them. 4, administer potassium supplements as prescribed. Okay, what are we saying? Okay, what are we saying? Okay, you got to go to remarnurse.com. Okay, not Remar Nurse University. That's something different. Okay, but I'm gonna go over all of this after this. Okay, so we have a nurse who's caring for a patient with Cushing syndrome. Which of the following is the most important nursing intervention? Number 1, monitor glucose levels closely. 2, encourage the patient to increase sodium intake. Are we instructing the patient to avoid weight-bearing activities? Or 4, administer potassium supplements as prescribed? Oh my goodness, what are we saying here? Very good. Very good. All right, I see the correct answer. It is indeed going to be number 1. Okay, patients with Cushing syndrome often have elevated levels of cortisol, which can lead to hyperglycemia. All right, that can lead to hyperglycemia. We know that for a fact, right? And so when we're doing NCLEX questions, make that one of your priorities. Okay, make that one of your priorities to understand that cortisol, steroids can absolutely increase blood glucose levels. Now, we know the patient should be on a low sodium diet. Weight-bearing exercises can be beneficial. Patients are at risk for hypokalemia with Cushing's disease, but that might not always be the case. But we absolutely want to make sure we are doing number 1, monitoring the blood glucose levels. Okay, good job, everyone. Let's go to number 2. Here it is. Let's do it. A nurse is providing discharge instructions to a patient with Cushing's syndrome who is prescribed a corticosteroid medication. Which of the following instructions is most important for the nurse to include? Number 1, increase your intake of potassium-rich foods. 2, avoid exposure to crowds and people with infections. 3, report any weight loss or muscle weakness to your healthcare provider. 4, take the medication on an empty stomach to increase absorption. Yeah. What are we going to choose in this situation? I see some ones. I see some twos. Okay. All right. Remember with NCLEX, we have to understand that we may see multiple answers that are correct. And so we are constantly prioritizing here because it's saying what is the most important, okay, to include. And that again, here requires some understanding of the basic content, okay? Correct answer is 2, avoid exposure to crowds and people with infections. Patients with Cushing syndrome who are taking corticosteroid medications, for sure, we talked about for sure they're going to have hyperglycemia. For sure, we know that steroids suppress the immune system. And so this is going to be the priority here, making sure that they understand that they are more susceptible to infections. Why? Because their body is not prepared to handle the stress of illness. Their immune system is going to be suppressed. So it is most important for them to understand that point. Okay. And this is why I see a good majority of us are not getting these correct. And that's what I want. I want you to be able to come here on Mondays and just realign, get the answers wrong here, get a different perspective so that when you're studying in the V2, you know how to prioritize these things. Okay. Let's see here. Another one here. A nurse is caring for a patient with Cushing syndrome who reports dizziness. What is the nurse's priority action? Number 1, advise the patient to avoid changing his shoes. 2, instruct the patient to increase fluid intake. 3, assess the patient's BUN levels. 4, assess the patient's blood pressure and heart rate. Okay. We're talking about Cushing's disease here. You're getting prepared to look at quick facts differently. When you go back and look at quick facts, or when you do the lecture in the V2, you're going to have an even better understanding of it. Yep. Okay. Correct answer here is number 4. Did you get this one right? I hope you did. This was a safety thing. Assess the patient's blood pressure and heart rate. Whew. Why? Because this patient is reporting dizziness. For a patient with Cushing syndrome who is experiencing dizziness, the priority action is to assess the patient's blood pressure and heart rate, because dizziness could be for many things. It could be hypertension, hypotension, cardiac arrhythmias, all of these things, right? So here we need to assess for the vital signs. Yes. Okay, I'm moving on. Let's look here. The nurse is caring for a client with Cushing's disease who is scheduled for an adrenalectomy. In the preoperative period, what is the priority action of the nurse? Number 1, adrenalectomy. Check the urine for glucose and ketones. 2, check the anxiety level of the client. 3, monitor the availability of the medication. Or 4, monitor the vital signs. So now we have a different situation. The patient is scheduled for an adrenalectomy. It's preoperative time, so they have not had the surgery yet. What's the priority? Okay. Did I distract anybody? I have a good distractor in here. The correct answer is number 4, still monitoring the vital signs. You got to keep your eye on the prize, okay? You don't get distracted. Even if the scenario changes, your priorities for Cushing's patient needs to remain the same. The vital signs give you much more information than anything else. I tried to distract. Some people I did distract. Some people I did get. But the correct answer is number 4. The priority nursing action is to monitor the vital signs, particularly the blood pressure. The nurse must frequently monitor vital signs and carefully observe clients with hypertension and those with cardiac disorders. So what I do sometimes here is sometimes I will just read the answers again, or I'll read the question again. And the reason why I'm doing that is because I know that if you're not confident, you will change your answer. And so I want you to see that it never pays off to do that. Okay. It never pays off to change your answer. So when you're taking NCLEX, it is very important that you have gotten rid of that nasty habit of second guessing. So I see some people asking, why is it not number 2? Again, this idea has to be taken into consideration, which is multiple answers are going to be right. So the question is never, why is it not this? Because it is number 2. But the question we should ask ourselves is, what is the priority? Or what is that's it. Okay. Because a lot of people did pick number 2 and they're asking, why is it not number 2? Number 2 says check the what? Anxiety level of the patient. Number 4 says what? Monitor the vital signs of the patient. So in what instance would we elevate the psychological status of the patient over the physiological status of the patient in Cushing syndrome? Never. Like, we're not going to do that because we are here to provide medical treatment, especially a patient with Cushing's disease. Okay. So vital signs are going to be most important. Now, because I said it's preoperative, some people understand and relate to being nervous before surgery. That is true. You can be nervous before surgery, but if you're the nurse, you better be more worried about the patient's blood pressure, heart rate, pulse ox than their nervousness. Okay. All right. So that's why it's number 4. My final question is this. Are we ready for it? Let's talk about it. A nurse is caring for a patient with Cushing syndrome in the ICU who is experiencing hypotension, hyperkalemia, and decreased urine output. What is the priority nurse's action? Or what's the nurse's priority action? Same thing. Number 1, administer a potassium-sparing diuretic. 2, prepare the patient for immediate dialysis. 3, administer the corticosteroids as prescribed. Or 4, restrict the patient's fluid intake. This is a good one. Patient with Cushing's is in ICU. They have hypotension, hyperkalemia, and decreased urine output. What is the priority here? My goodness, what's the priority? Oh, you got to read. You have to read. When you're taking NCLEX, you got to slow down and read because some of you guys are picking the wrong answer just because you're not reading it. I can tell already. Let me give you the right answer. So the right answer here is number 3. I'm sorry. Is number 3, which is administer the corticosteroids as prescribed. That's the right answer. Okay. Number 3. Let's talk about why. I'm sorry, I put the wrong number there. Let's talk about why. Because this patient is having what as the issue? They're Cushing syndrome, right? And so because of the Cushing syndrome, everything else is manifesting. So they're experiencing hypotension, hyperkalemia, and decreased urine output. What is the nurse's priority action? Well, we have to correct that Cushing syndrome, which we know is a deficit in the cortisol. Okay, so let me go back to the other ones. Number one, I saw some people pick number one, which is administer a potassium sparing diuretic. I think you thought hyperkalemia, and then you thought the potassium sparing diuretic would change or reduce the hyperkalemia. No. So potassium sparing diuretic means that what? We keep potassium. We keep potassium. So we would not want the potassium sparing diuretic. We would not want the potassium sparing diuretic in hyperkalemia. The second one, so a couple people picked this one. I threw this one in here for immediate dialysis. And dialysis may be needed if the patient can't continue to release their urine or void, but it's not an immediate treatment for Cushing syndrome. The immediate treatment for Cushing syndrome here in this patient would be corticosteroids, or there's one more thing that I could have put on here. What else could it have been a treatment for this patient that could have gone with the corticosteroids that would have helped the patient to be more hemodynamically stable? What's the other thing that I could have put on here? Corticosteroids or what? Corticosteroids or IV fluids. You typically would see in the ICU patients getting IV fluids for hypotension, decreased urine output. Okay. All right. So this is how we want to talk ourselves through these things. Number 4, restricting the patient's fluid intake. Not so much with hypotension and reduced fluid volume. We would not want to restrict their fluid intake for any uncertain reason. So the only one that really made sense was number 3, which was administer the corticosteroids as prescribed. Okay. Now, do you feel more confident? Do you feel better about that? All right. Do you feel better about that? And again, once you are exposed to the information, so like I said, quick facts. Like I said, I put this one in the V2. All right. I put this one in the V2. You will feel a lot better with it because there are a lot of scenarios that could have Cushing syndrome or Addison's disease involved in them. So let's do Monday motivation. Oh, no. I don't want to do. Let's keep it going and let's go into the V2. Let's go into the V2 and let's do the endocrine overview. So what I'm going to play right now is I'm going to go into the program. So get out your workbooks. If you have this book printed out, we're going to do page 82 for those of you who are just joining us. And the endocrine review is 10 minutes. It's a 10-minute video. Do we have 10 minutes for NCLEX today? I think that we do. Now we're going to do these 2 pages. So we'll actually do 81 and 82 for the endocrine overview. Okay, so I'm going to play it. And if you have the workbook, you can take notes in here. If you don't have it, this is a great opportunity for you to see why the V2 is the best NCLEX review for Next Gen NCLEX. I'm telling you right now, you will never see. It's so good. Okay, so I'm going to play this video right here. It's a 10-minute video. We got time today. Oh, wait, let me sign in. Sorry. I signed out too late. And V2, like, are you even here anymore? I'm signing you out. Okay, so let me go back into it. Endocrine system overview. Let's go. We're going to hit this play button. I got to play it from the beginning. Let me back that thing up. Let me play it from the beginning. There we go. Hey, let's keep going with the endocrine overview by looking at the thyroid gland. Now, ask yourself, what is the thyroid gland responsible for? When we think about the thyroid gland, it produces hormones, and the hormones help us to regulate metabolism, heart rate, brain development, and also your mood. Because metabolism is so important, you will see alterations whether you have too much of a thyroid hormone or too little. So let's look at hyperthyroidism and hypothyroidism. With hyperthyroidism, everything really goes up. That thyroid hormone of it, you're going to have, of course, a high metabolism, but also high vital signs. You're going to have a heat intolerance, diarrhea. You're going to be irritable and have exophthalmos, which are those bulging eyes. Hyperthyroidism is also called Graves' disease. Now, we're going to get into the treatment, but I want to start with the diet. It's important to know the diet for these conditions. So, for hyperthyroidism, the diet is going to be high calorie, high protein, and low fiber. Low fiber. High calorie, high protein, low fiber. And you may think, why low fiber? Normally, we want a high fiber diet. But because these clients have diarrhea, the high fiber diet is not going to be a good pair. So the treatment options, we have two options. The first is a radioactive iodine therapy. And I put the medication name for you here. It's propylthiouracil or PTU. PTU, propylthiouracil. When a client is on a radioactive substance to shrink the thyroid gland, the nurses have to use special precautions. Do you know what radioactive precautions are? Well, let me tell you. Radioactive precautions require the RN to use gloves and a gown. Also, a shield that they should wear. These clients should be in a private room. Now, they can have visitors, but the visitors should stay less than 1 hour. There should be no pregnant or nursing women to care for the client. So the client can do radioactive iodine or they can just have a thyroidectomy. The emergency that I want you guys to know associated with hyperthyroidism is going to be thyroid storm. Thyroid storm. Thyroid storm is a life-threatening crisis with the following symptoms. The patient has a fever, and I'm talking about a very high fever, like 106. They are tachycardic, they're hypertensive, they have deliriums, right? So it's just an exaggerated version of hyperthyroidism. The treatment is IV fluids and a cooling blanket. We want to give supportive therapy. Now, if you're talking about specific medications, you can give methimazole, propylthiouracil, or beta blockers to treat thyroid storm. Now, going to the post-thyroidectomy care, as a registered nurse, you got to know to teach these things. Number one, we're going to be monitoring our patient's calcium levels. And the reason why we do that is because if the parathyroid glands were removed, we know that the parathyroid glands are responsible for calcium absorption. We also want to check for bleeding at the back of the neck. Remember, if the client is lying flat, then they may not have any bleeding on their dressing, but behind their head, behind their neck, there will be a lot of drainage. So check there. Let me ask you these questions. After a thyroidectomy, is a hoarse voice normal? The correct answer is no. That's going to indicate laryngeal edema. What about frequent swallowing? No, as well. That indicates bleeding. How about a sore throat? What do you think? Yes, after a thyroidectomy, a sore throat is normal. Remember, we always keep oxygen, suction, and a tracheostomy set at the bedside. All right, let's look at the opposite of hyperthyroidism. It is hypothyroidism. All of the signs are down. The client is weak. They have fatigue. Their vital signs are low. They have goiters. There is a cold intolerance and weight gain due to low metabolism. We're going to get into the treatment, but we got to stop at the diet first. The diet is high fiber with increased fluid intake. What about the hormone replacement? Because that is what really is going to be necessary for this client who has a reduced level of thyroid hormone. We can give the medication levothyroid to the client. Now, we need to take this medication first thing in the morning on an empty stomach. For the client with hypothyroidism, we want to watch for hyperthyroidism when introducing thyroid hormones. Our nursing care is to teach the client to take the medication on an empty stomach. That's very important for absorption. And then once this medication is begun, the client must take it for the rest of their lives. That's a major teaching point. For endocrine, we are going to move on to the adrenal disorders. Now, the adrenal glands specifically are located at the top of each kidney. The adrenal glands help us to handle stress by making steroids. We're going to look at a symptom of too little and then also a symptom of too much steroid. So Addison's disease is too little steroids. And you may be familiar with this, but the signs of Addison's disease or the signs of a client who doesn't have enough steroids in their body are going to be fatigue, weight loss, weakness. The client will have a bronzed colored skin, hypotension as well. I want to talk about the lab profiles because these are the laboratory changes that you expect to see in Addison's disease. And they are hypoglycemia, hyponatremia, and hyperkalemia. Clients with Addison's disease have a decreased ability to fight off infections. Oh, the treatment for Addison's disease is quite simply to place the client on steroids. And this is done, for adrenal insufficiency. We need to place those clients on steroids. Cushing syndrome is too much. It's too much by the adrenal cortex. You have too much of that cortisol, those steroids. It's just too much. So those things are going to change the way a client looks. So when a client has Cushing syndrome, you will see that moon face, buffalo hump, shrunkel obesity. They'll have muscle atrophy. So they'll have thin arms and legs, hirsutism in the female, impotent in the male, and they will bruise pretty easily. When we look at the lab profile, you will expect to see hyperglycemia, hypernatremia, hypokalemia, and decreased lymphocytes. How do you treat Cushing syndrome? You do an adrenalectomy, take away the adrenal glands, and then put the client on lifelong steroids. That is how you treat those two conditions. They're kind of similar. Remember, if you're temporarily giving steroids, you never abruptly stop them. They always need to be tapered off. Oh, I'm so glad we did this endocrine overview. Let's go on. Okay. So I Y'all know I have the workbook. I was trying to take notes. The thing about having the workbook when you're watching it is that it makes taking notes a lot easier because most of the text, I don't know if you can see it, it's kind of hard to see, but most of the text is filled out and you're just putting in the major points that I have on the screen and not even all of them. So we were able to do hyperthyroidism, hypothyroidism, Cushing's, and Addison's all in 10 minutes. This is why I believe most of you would have your license if you had V2 already. Most of you would have your license if you had V2 and you've been studying in it because the training part is the easiest. Okay. It's just getting you to start the training. That's the hardest part for some of us because we're used to doing it a different way. And some of you who just have quick facts, you love the quick facts book, but you're missing the most important part of the review, which is the lectures. So 50% off of the V2 right now. 50% off of the V2 program is happening right now. If you go to remarnurse.com, and you are able to do that, you're able to join in, log in. If you're in Africa, if you are in the UK, there is a different way that I want you to go about getting the V2 program. So please send me an email at support. I'm gonna put my email address. If you're in Africa and you want to get the V2, I want you to use our partners in our production company in Africa because it will help you get the information without having to wait for the US Customs. Okay. So my email address is support@remarreview.com. Support@remarreview.com. And that is how I want you to join if you're in Africa. Okay. If you're in Canada, if you're in the US, you can also email me if you want to just ask me questions. I have no problem with that. But you can get it if you're in the US and Canada, just if you're in Africa. And then also, so if you're in Africa, also they're putting up the WhatsApp number also that you can reach out to and just say that you want the V2, the NCLEX V2 on WhatsApp or start a conversation or however you want to do it. And you're able to do that right away. Okay. Because again, people that come on here, what they're saying they're using is the V2. That's what they're saying they're using. And so I want you guys to be able to have that same thing. All right, I'm still waiting for my V2 trainer and quick facts. Okay, it's coming. It's coming. But also don't forget, if you have the V2, you can start studying from it right away. Okay, you don't necessarily have to wait for the books to arrive. Okay, the 50% expires in 10 days. Okay. All right. But yeah, if you have V2 and you have access to it, go in there. There's still the question bank. There's still, the getting started portion. A lot of you don't do the getting started portion of the V2, so you're not sure how to use it. All right. So remember, if you have V2 and you go to the 30-day challenge section where this young lady is, in the beginning, these are all the getting started tutorials. Okay. Getting started tutorials. Watch those videos. Okay. Watch those videos so that you're able to do that. Okay. I cannot see the book V2 on my question bank. All right. So the question bank in the V2, remember, is right here. If you go to this left panel, okay, if you go to this left panel, you go to the file vault here. All right. Right above the file vault is the question bank. So if you click on the second, or if you click on the second icon, you're able to go into the question bank. There's 2,700 questions, 2,755. Okay. And then you're going to create the new test right here. You can create a new test. Again, with V2, you're able to pick your subject. You name the test. Say if you want to name it NCLEX. And I'm going to show you guys how to sign up for V2 in a second. All right. You're able to name the test. You can pick the subjects. You can pick if you want it on easy, hard, moderate. Okay. You can do your case studies. You can do anything here for this type of question bank. It allows you to do your questions as well as watch the videos all in one place. And that's one thing I love about the V2 is that you're able to do practice questions and content. And this is the best advice for me to give to you is when you're preparing for NCLEX, just use one source. Don't be using a whole bunch of different sources because that's where confusion comes in and you don't end up committing to one thing. You don't end up committing to one thing, which is a problem. Okay. All right. So let me, what I'm going to do really quickly is I'm going to show you how to sign up for the V2. I'm going to go to my website. I'm going to show you how to sign up for it. All right. Somebody said, this is some good stuff. Somebody said, look, Sabrina, I'm so happy that you came from Monday Motivation. Up until today, my V2 in Quick Facts was collecting dust, not any. This is some good stuff. Thank you. Okay, perfect. And again, everybody's in different places. Some of us have the V2. We just haven't been studying. We haven't been consistent. So now we have the opportunity on Mondays to recommit to this process. Recommit to this process. I just renewed my V2, but I already answered my lesson questions, but I want to start all over again. So I don't know if you can reset my questions. We can start you all the way from the beginning. Just send me an email, support@remarreview.com. We're able to do that. The V2 has been updated. There's so many new updates to the V2. So make sure you're in the place you need to be. Okay. If you want to sign up for the V2, just really quickly, somebody says, if you want to sign up for the V2 really quickly, let's go to, let me show you how to do that. The 3-month, our Kenyan partners are offering 3 months in the V2. And that is because for our nurses in Africa, we understand that it takes sometimes a long time to get your paperwork, to get your books, to get your materials. And so the 3-month option is the best option. I 100% would take it. Even if you're like, well, I only want to do 30 days. There's nothing wrong with giving yourself more time because life happens. Life happens. So reach out to them. Reach out to them. All right, let me go here and then let me go into a private browser. Let me go into a private browser here. Let me get out of the test and let me try to open up. Okay, so what I'm gonna try to do, and y'all know I'm not the tech person, but I definitely want to make sure that I'm showing this. All right. So if you just open up your, let me go to a private window, new private window. Okay. So if you open up your browser and you go to remarnurse.com, watch me, remarnurse.com, it's going to pull up my website. Okay. That's me. You can only get V2 from me. Okay. So watch out for these scammers out here. Then what you will do when you go to the website, you will select your course. Step 1. Select your course. Okay. I'll just block that out for a second. RN or PN? RN or PN? Which one are you? Okay. If you're a PN, you're going to click PN. If you're an RN, just go to RN. Okay. Now, with the price, the 50% discount is reflected here right now. So these prices will go up once the 50% off sale goes away. All right. So it's $69 for a 30-day full program. The full program is everything in it. Okay. So all of these prices, whether you get the 30-day, the 3-month, or the 6-month, they're all full program options. So that means you're going to get the lectures, you're going to get Quick Facts. Okay. You will get the downloadable workbook. You'll get the question bank and the computer adaptive exams, plus the daily study calendar. So it does not matter. People say, which one is the full program? They're all the full program, the 30, the 3-month, or the 6-month. Okay. So what you will do is pick which one you want, which one is going to make the most sense for you. I would say if you feel like you need more time, just go with the more time right off the bat. All right. So click on let's just do the 3-month. If you click on join now, okay, it'll say you'll get 3 months. And then after the 3 months to stay in the V2, there'll be a $50 monthly renewal. That's why I'm saying go ahead and pick the one that is best for you. Okay. And exactly. All right. So you go to readmarnurse.com to sign up. So you go join now. Okay. Now you click on join now. It's going to tell you over here, go ahead and fill out your details, first name, last name. Over here is what I want to show you. I want to show you how to pause your V2 start date. This is how you pause it so that the subscription does not start right away. Some of you want to purchase it now or before the sale ends, but you don't want to start until September. Let me see if that's possible. So if we go here, okay, there's a calendar here. Click here to delay your start date. Okay. If you click on here, this is where you can change your start date up to 90 days. Okay, up to 90 days. So you actually, yeah, you're able, yeah, okay. So you're able to pause your start date even until September the 24th. Right now, if you order today. So you can hold it for all this time. Okay. Now, that's how you change your start date. So when you click on whatever start date you want, say I want August the 15th. Okay, so it will show that you have it here. Now, what I'm going to do is I'm going to take out the quick facts because some of you guys already have this book. And what you're wanting is just the lectures and the computer adaptive tests in the question bank. So you can take off the quick facts book. And what you can do is you can add the physical workbook. Okay, because some of you don't have this book right here. You don't have this one, and this one doesn't come included. So you have to purchase it. So right now you can purchase it. So if you put on the physical workbook here, you're able to do that. All right. And that's where you get the books. That's where you sign up. That's how you sign up. It's a really simple process to get the V2. And then all you have to do is confirm your email address and you'll get instant access to the program. Okay. You'll get instant access to the program. Remember, I am physically sending you quick facts in the mail. I'm physically sending you this book. So this book will take like 3 to 5 business days. But if you going into the V2, you do not have to wait for this book to come to you to begin studying. Actually, you do not begin studying this book until almost the middle of the program. Okay, so while you're waiting for this book to come, you should be in V2 watching the maternity lectures. You should be watching the developmental milestone, the infant heart defects. All of those lectures you watch before Quick Facts comes to you. So that's why I say when we get off here, okay, go ahead and get into the V2 so that you can be ready to give your testimony. That's what's happening. All right. Okay. Any other questions about the V2, where to start it from, things like that? Okay. And like I said, refer to the daily study calendar on when to study everything because I wrote it there for you. So it's all there, when to do the CAT exams, when to study quick facts, all that stuff is there for you. Okay. All right. So the Monday motivation that I just want to encourage you with, because if you're like me, you need encouragement. Okay. Hold on one second. And let me just answer this really quick. This is a good question. I'm a repeater. When I repurchase at 50, do I get all new questions? So when you resubscribe, you still have access to the platform. So that means you will be able to keep your progress where you are. That means you will be able to have access to the question bank. You can even restart the course if you want to from zero. But most people who are subscribing at the $50 a month, they just have not finished their course and they don't want to have to start all over again in order to get their certificate or in order to do the computer adaptive exams. Okay. So that's the idea. You're holding your place in the course. Okay. And then you're also having access continuously to the question bank and the computer adaptive exams. Because if you don't have your subscription active, then you don't have access to any of your study material. Okay. So all you will have is your quick facts and whatever work you have done. So that's why I say, pick the time frame that works best for you, that you will be able to finish, you'll be able to finish the course. The 30-day challenge program, please. How do I get in? Cool. 30-day challenge. And you guys paused me, but that's okay. Let me go back into the V2. So we were in the question bank. In order to get to the 30-day challenge, you do these 30-day challenge videos after you do a study session. So for example, if you're doing study session number 8, after you do everything on study session number 8, it says you watch body positions, disaster management, look here, herbal medications. Then you're going to read, and these videos are not long. So when you see body positions, disaster management, herbal medications, if you go into your course and we just look for these ones, body positions is 8 minutes. You'll take a little progress quiz. Disaster management is 9 minutes. And then herbal medications is 6 minutes. So literally, those are the videos you have to watch for that day. You'll read study session number 7. You'll go into quick facts, do the work, pharmacology work there. And then you'll spend 30 to 45 minutes in the question bank. After that, then you can do the 30-day challenge video session number 8. Okay. So where do you find the 30-day challenge number 8 for study session number 8? If you go up here and you do the second circle, this is where the 30-day challenge is. Okay. And you would look for number 8. Okay. And this is a 9-minute video, and it goes with study session number 8. Now, when you do study session number 9 and 10 and 11, you still have 9, 10, 11 to do. Okay. And you just watch those videos, and you will have 20 challenge videos for the 20 study sessions. And those are really important too, because that's me trying to make sure that you know what you're supposed to know. Okay. That's me trying to make sure you know what you're supposed to know. Okay. So, very cool. Very cool. So this is V2, Remar V2 and quick facts are all you need. I only did the content without using the question bank. Knowing your content is key. Thank you, Professor Regina. Remar V2 is very helpful. And I can totally see how that's possible. If you watch the lecture videos in V2, you fill out the workbook, and then you do quick facts, you are able to pass NCLEX. You're able to pass NCLEX, and you don't have to do a lot of questions. You really don't. But the questions are there for you. Barbara says, I purchased this 6-month package. Will I need to purchase the workbook separately? So yes, if you want the physical workbook, yes. Now, if you don't want the physical workbook, you get access in the V2 to the downloadable workbook. This one is in your file vault. So it's there for you to, it's like 100 pages. You can print it out yourself if you have a printer at home. I have a printer at home. Or if you want to go to the local print shop, you can print it out yourself. I forgot how much it costs to print it out. Somebody told me, but I can't remember right now. Only reason why I offer this is because a lot of people may not have a printer or they don't have access. And you could even go to the library, honestly. All right. So I offer this. This is extra if you want the physical workbook. Okay. So good question. Good question. What else? Is that it? Okay. All right. So this, so that's how the program works. I want to get into Monday motivation because I don't like keeping you guys long. I know Monday's very busy, but this is important for us to set our week. So seasons may change, but God doesn't. Seasons may change, but God doesn't. You know, we just started the summer season here. It's a couple of days ago. We are definitely in a new season. I like this from Jeremiah 17:7-8. Let me read this. But blessed is the one who trusts in the Lord, whose confidence is in him. This is so important that you are trusting something other than yourself to get you through the difficult times when seasons change. Jeremiah, we know him to be a prophet, right? In the Old Testament. The thing about Jeremiah is that God tells him, before you were in your mother's womb, I knew you. Like I had an assignment for you. And for those of us who have a special calling on our lives, that we are supposed to be doing something, the life that we have is not easy. The life that we have is not easy. And we have to say no to a lot of things that other people can say yes to. When you have a special calling on your life, you cannot do what everybody else is doing. You cannot go where everybody else goes. You cannot partake in, what seems like the fun that everybody around you has. And Jeremiah knew this specifically because his life was very challenging because he was trying to live to a higher standard. And so for those of us who know, we know. But what he's trying to tell us is that even though you may be dealing with a new season in your life, right? And it might be you trying to get back into something that you did a long time ago, but it's still a new season for you. You're trying to do something new. You're trying to evolve. You're trying to grow, right? Spread out your wings. Those times can be very difficult because we're all in a comfort zone. We're all trying to, avoid as much discomfort as possible, but that's not really how you grow. That's not really how you grow. You grow by being uncomfortable. You grow by, doing new things and exposing your mind to something different. And that can be scary. That can be scary. So what Jeremiah is reminding us to do, he's saying, hey, they will be planted. Those who trust in God, they will be like a tree planted by the water that sends out its roots by the stream. He's saying you're going to be grounded. If you trust in God, no matter what comes your way, you're going to be secure. A tree planted by the water, they have nothing to worry about because the roots are doing the work. The roots are running deep. The roots are what's keeping the foundation sure. The foundation sure. And in a world where it is very fashionable to be like everybody else, it is very fashionable to see these images on Facebook and Instagram and want what you see. Even though it's very fashionable to do that, it is more profitable to be an individual that has their own calling and leading a different standard of living. Man. And so in order for you to do that, you have to be grounded in something else because the world will throw so much at you. This week, let me tell you, you're going to get so much thrown at you that if you are not rooted and grounded, you will find yourself confused, tired, anxious, double-minded, not feeling like you have direction. So set your foundation and your hope in Christ. He is the one that allows us to have those deep roots where we have no lack. Because most of you, really, you have no lack. You're actually looking for more. You're looking to test God to give you more, but he's already provided more than you ever needed. But we want to take it up a notch. We want to say, God, I want bigger. Like you said, I was the head, not the tail. So make me the head. I like that. It does not fear that tree. It does not fear when heat comes. Woo! Its leaves are always green. Its leaves are always green. It has no worries in a year of drought and never fails to bear fruit. The takeaways are, number one, do not allow yourself to be shaken by circumstance. This week, don't allow yourself to be shaken by circumstance, sight, emotions, or feelings. And this is for me, y'all. This is not for you. This is for me. Trusting in God means to also trust in what? His word, the Bible. You have to understand that the words in the Bible are true and they're given for your profitable instruction. 3 is God is consistent. He is a consistent source of strength to those who are rooted in him. So that's a good feeling. And you should really take the time this week to consider all that you do have and how he has kept you and how he has brought you up into this point. And God didn't bring you to this point to leave you. He didn't bring you to this point so that you could be stuck. So get out of your own way and trust that God will continue to do what he said he'll do, because his timing is not your timing. That's the thing. You looking at the clock too much. When the time is right, the Lord says, I will make it happen. That's what the word says. And so take your eyes off yourself and your situation and turn them to Christ, who is the author and finisher of your faith. That's it. That's it. So thank you guys so much for coming to class today on Monday. I hope we have a good feeling about where we are in our studying process and where we are with our relationship with God. Okay. And if we don't, then there's something that you can do about that. There's something you can do about that. You do have power in those areas of your life. Okay. Just understand that a lot of things that people are out enjoying right now, you cannot. You just cannot. You have to be separate during this time. Okay. So get in alignment, govern yourself according to the word of God. And you'll get there. You'll get there. And as always, I really, really believe this. I want you to believe it too. You can, you will, and you must pass NCLEX. You got to do it. You got to do it. Also, don't forget, tonight, 8 p.m. Eastern time, I'm coming back for you. Remar Nurse University. Super excited to finish our workbook tonight, 8 p.m. Eastern time. Be there, be square, okay? Have a great Monday. I'll see you guys later. Bye-bye.